Assalamu alaikum. I am Dr. Shazia Afroz, Associate Professor, Department of Pharmacology, Boshundhara Addin Medical College. Today I am going to discuss about drugs used in heart failure. At first, I am going to classify the drugs that are used in heart failure. Ionotropic drugs, cardiac glycosides like digoxin, digitoxin, sympathomimetics like dobutamine, dopamine, and phosphodiesterase 3 inhibitor like amrinone and milrinone. Number 2, diuretics. High ceiling diuretics, thiazide like diuretics. High ceiling diuretics are furosemide, bumetanide, and thiazide like diuretics like hydrochlorothiazide, metolazone, indapamide, etc. Inhibitors of renin-angiotensin systems, ACE inhibitors, enalapril, ramipril and others, and angiotensin antagonist like losartan, valsartan, olmesartan, telmisartan, etc. Vasodilators like venodilator, arteriolar dilator, and both arteriolar and venodilator. Venodilators are glyceryl trinitrate and other nitrates. Arteriolar dilators like hydrolazine and arteriolar plus venodilators like sodium nitroprusside, and beta blockers like metoprolol, bisoprolol, carvedilol, etc. Aldosterone antagonist like spironolactone, eplerenone, etc. These are the drugs we are randomly used in heart failure. Mechanism of action of cardiac glycosides. Digoxin inhibit the sodium potassium ATPase enzyme by inhibiting the potassium binding site of this enzyme and increase the intracellular sodium concentration, inhibit sodium calcium exchanger and relative reduction of the calcium expulsion from the cell, and increase intracellular calcium concentration, increase calcium uptake and calcium storage in the sarcoplasmic reticulum for the later release, and calcium causes the contraction coupling and increased myocardial contractility. What are the indications of cardiac glycosides? The indications are congestive cardiac failure, cardiac arrhythmia, atrial fibrillation, atrial flutter, and supraparoxysmal supraventricular tachycardia. What are the adverse effects of cardiac glycosides? They causes several adverse effects in different system of our body. In cardiovascular system, it causes various cardiac arrhythmias, ventricular ectopic beats, ventricular tachyarrhythmia, paroxysmal supraventricular tachycardia, and heart block. In GI tract, it causes anorexia, nausea, vomiting, and diarrhea. Cardiac glycoside have a structural resemblance to the estrogen, so it causes gynecomastia in case of male, and in case of female it causes breast enlargement or galacturia. In eye, it causes disturbance in color vision, yellowish vision, that is called xanthopsia, and photophobia, blurring of vision may also occur. In central nervous system, it causes confusion, agitation, nightmares, and psychosis. What are the contraindications of cardiac glycosides? It causes ventricular arrhythmia, ventricular tachyarrhythmia, heart block, hypokalemia, hypercalcemia, liver failure, and renal insufficiency. Now, I am going to tell about the antiarrhythmic drugs. At first, I am going to discuss about the classifications of drugs that are used in arrhythmia. Class 1, membrane stabilizing agent or sodium channel blockers. Class 1A, moderately decrease the zero phase, quinidine, procainamide, disopyramide, etc. And class 1B, lidocaine, class 1C, propafenone and flecainide. Class 2, the anti-adrenergic agent, that is beta blocker, Propranolol, ismolol, sotalol, etc. are used as class 2 drugs. Class 3 drugs are amiodarone and brtylium. Class 4 calcium channel blockers like verapamil, diltiazem, etc. Class 1 sodium channel blockers. It restricts the rapid inflow of the sodium during the phase 0 and slow the maximum rate of depolarization. This property is called membrane stabilizing activity. This action contributes to stop arrhythmia, limiting the responsiveness to excitation of the cardiac cell. Class 1A, it lengthens the action potential duration and refractoriness. Class 2B, shorten the action potential duration and refractoriness. Class 1C, have the negligible effect on action potential duration and refractoriness. Quinidine, it is seldom used nowadays due to its risk of adverse effects. It is effective in atrial and ventricular arrhythmia. What are the adverse effects of quinidine? Serious ventricular tachyarrhythmia, quinine syncope or synchronism, diarrhea, skin rash, gastrointestinal symptoms, thrombocytopenia, fever. Class 3 amiodarone. What is the mechanism of action of amiodarone? It prolongs the ADP and QT interval to block the myocardial delayed rectifier of the potassium channel, and it prolongs the effective period, refractory period, block the inactivated sodium channel with rapid rate of channel recovery. It partially inhibits the myocardial calcium channel and has non-competitive beta adrenergic blocking property and alter the thyroid function. So, it is called the multi-channel blocker with some additional activities. Amiodarone adverse effects are in cardiovascular effect, it causes hypotension and bradycardia. In GI tract, it causes nausea, vomiting and GIT upset, and others like skin pigmentation, corneal microdeposits, pulmonary alveolitis and fibrosis, peripheral neuropathy, liver damage, inhibition of the peripheral conversion of the T4 to T3, goiter, hypothyroidism, and rarely it causes the hyperthyroidism on chronic use. Class 2 catecholamine blockade or beta blocker. Beta adrenoceptor blocker are effective in prophylaxis of the cardiac arrhythmia, and it probably because they counteract the anti-arrhythmic effect of the catecholamines, and rate of automatic firing of the SA node is abolished, and prolong the refractoriness of the AV node, and also possesses the membrane stabilizing properties. It is effect for supraventricular tachycardia, those associated with the exercise, emotion and hyperthyroidism. Now finally, the class 4 or calcium channel blocker verapamil depress the myocardial contraction more than others, and both verapamil and diltiazem also slow the conduction of the AV node. Thank you so much for today. Assalamu alaikum.